All right, thank you for waiting. I've been invited here by Henry Shanhallis to talk about patient retention and how you can use dental marketing to attract new patients or retain existing patients in your practice. But what I'm really here to talk about is the struggle, and it's the struggle that you guys experience on a daily basis, trying to run your practices, trying to keep patients in your practice, trying to get new patients in. And once upon a time, this is how you might have been able to advertise and market your practice. But things have changed. And nowadays it might look a little bit more like this. There are so many things that you could or should be doing to market your practice. It's quite overwhelming to keep up. There's so many changes with everything, with the way that you could be marketing your practice. The landscape constantly changes, and especially online. And on top of the changes in marketing, there's changes in your dental practice. So what you're facing, and when we talk to practices, is you're facing increased competition locally and overseas. There's the corporates, the insurance providers that are squeezing the practices everywhere. You've got the oversupply of dentists, which I think everybody agrees is the case. And on top of that, you've got ever-rising operating costs. Your patients are much more marketing savvy, and they are much more discerning. They are more educated when it comes to shopping. They are much more educated when it comes to marketing. They are much more discerning when they evaluate your services against other services. And a story I want to share with you about overseas dentists and dentistry is something that happened to me recently. So I'm doing this business course, and there's some pretty high-flying business people on this course, and there's a guy that is running a pretty successful business. It's probably got a turnover of between $6 and $10 million. So he is pretty smart, pretty affluent, CEO of his own company. And he came up to me recently on the course and he said, "Carolyn, I've been wanting to talk to you." I'm like, "Great, tell me more." And he said, "Look at me." And I'm like, "Great, you're looking fantastic." I'm thinking, has he gone to the gym? What's going on here? He said, "Look, my teeth." It's like, "Oh, right, okay." He said, "I've just come back from Phuket and I've had full mouth veneers." I said, "Okay." He said, "It would have cost me $25,000 to have that done here in Australia." He said, "It cost me $7,000 in Phuket and I got a holiday." So in my mind, the people that were heading overseas were the ones that were price conscious, short of money. Is that the assumption you guys were making as well? This guy is absolutely not short of money. And if people like him are heading overseas, what does that mean? So, it is tough out there, and we talk to dentists on a daily basis and we hear the struggle and the constant struggle. And on top of that, you need to market. The fact that you're here, I'm guessing that you recognise that you need to be doing something in your practice to market your practice. But when it comes to marketing, things are changing there, and there's challenges there as well. I'm guessing that some or all of you are getting called by companies all the time, SEO companies, Google Ads companies, telling you what you need. The local paper, the local radio station, people are always on the phone or emailing. Is that true? And I'm guessing that your friends and your family and your team are all offering you really good advice on what they think you should be doing as well. Blog posts, papers, there's always somebody that's got a great idea of what you could or should be doing to market your practice. And it is changing, it's constantly evolving. It's my full-time job to watch this constant change, and even I will turn on Facebook, check something, go, "Wow, that's changed since last week." It's the movement is so fast nowadays. And I'm guessing that what you guys want to do is actually just run your practice and deliver great clinical work to your patients. So thank you to those of you that filled in the survey before tonight. This is, so we've got 27 people that have responded so far. And this is a poll to see what you guys are finding hard about marketing your practice. So as you can see, the number one is skills and knowledge. People not having the skills and knowledge to market their practice. They don't feel comfortable. And that's a reflection on the events that I'm running and seeing with Henry Schein, that there is a large demand. Second one is finding the time. You know, realistically, you guys are working in your practice. You know, who has got the time to think about marketing your practice? You know, it is hard. The next two is starting, that you don't know where to start and you don't know what's working, what isn't working. And then you've got finances, don't really know how to set a budget, really don't know what you should be measuring against. And then the final one is not getting the right advice. So the items that I don't cover in tonight's seminar is all covered in the book. So elements of all of this are covered in the book. Things that I don't talk about, I'll indicate where you can find more information. So tonight's seminar, I'm hoping that you get some tips, that you get some understanding of what you can do and take it back into your practice and take action straight away. I hope that you'll have some good understanding, so when you are talking to your suppliers, that you can go and ask the right questions and make sure that you're getting the right information back from them. I want you to think about what's right for you and what isn't right for you, because obviously everything that I'm talking about is not going to be right for every practice, because every practice is different. Some things will be great, some things you'll go, doesn't work for me, and that's okay. And I know you guys like lots of examples, so I've put lots and lots of visuals throughout the slides so you can get examples of what other practices are doing in their marketing. And I hope that you will get some inspiration, some entertainment. You know, I appreciate that you're giving up your evening to be here, so hopefully it will be light, interesting, and maybe just spark a few thoughts. So what I will cover tonight is some marketing basics so that everybody's on the same page before I start going deeper. I want to talk about internal versus external marketing. So again, there's a good understanding of some basics in your marketing. Then I'll go through patient retention techniques, some tools, things that you could or should be doing in your practice, and then at the end, hopefully we'll have some time for questions. The fact that it is a relatively small group, please feel free to ask a question, because I'm sure that the question that you're all thinking, somebody else will have that same question. So please feel free to put up your hand, shout out. I don't have a mic tonight, so if you can't hear me again, let me know if I need to go a little bit louder. You can relax. We can send you a copy of the slides, and as you can see, it's being videoed as well, so we'll be able to send you a video of everything tonight. There's a form in front of you. If you just fill that in, we can make sure that the slides and the videos get sent to you. And also, if you do have questions that aren't covered in the seminar tonight, there is a private Facebook group, so only people that have been to the events can join this group, and you can ask questions there, and me and the team will be able to answer those questions. Okay, so who am I? As you can tell, I have a really strong Australian accent, but I have been here for 18 years, so British accent doesn't go. Some people think she's talking about dental marketing, she must be from America, so sorry to disappoint you. Everything that I'm talking about is based on the Australian market, so 18 years working in Australia, and everything I talk about is based on the Australian market. So no overseas. You know, it's my belief that what works in America doesn't necessarily work that well here. You know, the market is different. So I've got 10 years in, probably more than that now, marketing specifically in the dental medical area, and I have over 20 years in sales and marketing. You know, why am I here? I'm here because I need you guys to get educated. I need you guys to understand what is and isn't working in your practices. I need you to take control. I need you to understand your marketing. I need you to talk to your suppliers and really understand this. I hear so many war stories from practices that are doing things that aren't working. They've been sold things that they didn't need. They don't understand what they're buying. They're getting reports from suppliers that they don't understand. So I guess my mission in life is for you guys to take control and to really understand this, and to hopefully present it in such a way that the basics are there. that you can understand this, that it's not scary. You know, the things I'm talking about are really quite basic, and I want you to really get to grips and take back control. So the book has been written in such a way that you can dip in and out, that it's got case studies in there, it's got checklists in there, so you don't have to read it cover to cover. You can just pop in, flick to the areas that you need to look in, and hopefully it will help you on your way. So My Dental Marketing, who are we? We were established in 2009. We are focused on dental marketing. Historically, we did focus in health and medical, but 25% of our business is still there, but absolutely everything that we do, all of our research is based in the dental marketing space. We've worked with over 400 practices in Australia and New Zealand. And this is some of the team. Slight gender bias, but our photographer, or one of our photographers, is male. So, and Susie's at the back, so if you do have some questions at the end, there will be two of us that can field questions. And what do we believe? We believe that every practice is unique. We believe that your marketing needs to reflect your difference. You know, there are no McDonald's, hopefully, in dentistry, that you need to think about what makes you different, and you need to think about your strengths. We also believe that marketing needs to be an integral part of your business. You're running a business, your practice is a business, and marketing needs to be part of that business. And we believe that long-term communication with your patients is absolutely critical to the success of your practice. So now you know a little bit about me. I'd like to just find out a bit about you, if that's okay. So who here is a practice owner? Great. Practice manager? Fantastic. And team members? Okay. Who here's come with somebody else from your practice? All on your own? Oh, a couple. Okay, great. And who here is responsible for your marketing? A few? Okay. Not sure? Who here thinks that the marketing of their practice is going really well? Nobody. Who here thinks it's going, you know, okay, kind of happy? Great. Who here thinks it's on track but probably needs to tweak a few things? Yeah, that's good. And who here thinks, you know, it's just not working for me, but you know, not happy at all? And who here just doesn't know? Great, thank you. Thanks. Okay, well, hopefully at the end of tonight you will know a bit more about what's working and what isn't working, what you can do.